Welcome back to Rural Health News, the segment of Rural Health Today where we fill you in on the latest in rural health headlines. We'll cover 3 headlines in today's episode: what is most urgent, a rural health damage report, and a success story to send us into the week. Now, first, what is most urgent? The healthcare workforce has faced some of the most challenging years. Between the pandemic, increased turnover, and federal policy shifts, we have faced it all. Many hospitals look outside the United States to fill the gap in patient care by staffing shortages that have been created because of all of these reasons. And last week, President Trump signed an executive order to charge employers $100,000 to issue any new H-1B visas for foreign workers. In the context of healthcare, H-1B visas allow hospitals to hire doctors and medical students from outside the United States. According to the executive order, employers abuse the visa, and that has led to a national security threat. While the order allows for some exceptions to be made according to the discretion of the Homeland Security Secretary, many rural hospitals are very concerned about losing access to a necessary source of healthcare staffing. To see a map of which states issue the most healthcare-related H-1B visas, check out the link in the show notes below. On to the damage report. For nearly 15 years, hospitals have operated under the Hospital Readmissions Reductions Program that was enacted by the Center for Medicare and Medicaid, which requires providers to pay penalties based on readmissions of our patients. Now, these penalties are meant to discourage preventable readmissions and improve patient care, but the built-in criteria puts hospitals in an increasingly difficult position due to the fluctuating admission rates that we face and the program's failure to account for factors outside of the provider's control. Such things include the acuity of the patient, the return of that patient because of other symptoms or other issues that they have faced, such as secondary conditions known as heart attack or stroke. Before fiscal year 2026, CMS was charging fewer readmission penalties year over year. However, what is most concerning is new data from CMS reveals the number of hospitals expected to be penalized 1% or more will rise this year. This is the first year that penalties will increase rather than decrease since 2021. According to the American Hospital Association, this increase could be due to CMS reinstating pneumonia as a readmission data factor. Previously, it was excluded due to the overlap with COVID-19. We're not sure all of the specifics of this reasoning, but we certainly are very concerned about it. The AHA also believes the rate of hospitals facing penalties will rise more drastically in fiscal year 2027 as CMS begins including Medicare Advantage enrollees in the readmission data review process. And now for today's success story. Alzheimer's disease is notorious for its devastating impact on quality of life for patients, family members, and our communities. For the first time in human history, scientists have slowed the progression of this disease. That's according to Juan Forte, head of the Neurobiology of Dementia Group at the São Paulo Research Institute. Alzheimer's has long been the subject of diagnostic and pharmacological research, and now the entire field is holding its breath. The disease is caused by beta amyloid protein, which accumulates and destroys the brain's neurons. A new generation of drugs has been found to slow down the progression of the disease by binding and eliminating the proteins, namely lecanemab and donanemab. The discovery has been met with some controversy due to the drug's potential side effects. But while these treatments will require further study and testing, the breakthrough is inspiring hope for the families of 7 million Americans who live with Alzheimer's. Thank you to our sources for this episode: Newsweek, Becker's Hospital Review, Modern Healthcare, KFF Health News, American Organization for Nursing Leadership, El País, and Alzheimer's Association.
Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan, and a member of the Health Podcast Network. Our host is JJ Hodshire, our producer is Kirsten Newlon, and our audio engineer is Kenji Ulmer. Special thanks to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.